Hello, I'm Emily Hanno, a postdoctoral researcher at the Harvard Graduate School of Education. I'm excited to share a bit about the work my co-authors and I have done to examine changes in children's behavioral health and family well-being during the ongoing COVID-19 pandemic. As we are all well aware, children and families have confronted unprecedented challenges in the past year, ranging from the direct threats of the coronavirus disease itself to widespread consequences of associated public health measures, including school closures, changes to the labor market, limited access to public resources like playgrounds, and rising food insecurity. All of these factors, along with many others, have raised concerns about how children and families are faring during this global public health crisis. We've seen numerous stories in popular news outlets on parental stress and children's mental health in the midst of this pandemic. And there's a growing body of empirical evidence confirming the pandemic's threats to children's behavioral well-being. Yet there are still many unknowns. Specifically, as most research has relied on cross-sectional data collected during the pandemic, it is hard to know how much children's current behavioral health represents a departure from their pre-pandemic levels. We also know little about which dimensions of children's behavioral health have been particularly affected, and whether shifts in children's behavioral health have co-occurred with changes to family and parental well-being. In this paper, we sought to address these limitations, and in doing so, shed light on changes in child and family well-being during the COVID-19 pandemic. We used data from the Early Learning Study at Harvard, or ELSA, an ongoing population-level longitudinal study of over 3,500 young children across Massachusetts. As this map illustrates, our sample spans most of the state, including urban, rural, and suburban areas. Data for the present study came from parent surveys collected over the first 3 waves of ELSA. Wave 1 spanned 2017-18, Wave 2, 2018-19, and Wave 3, 2019-20. This means that Wave 3 coincided with the start of the COVID-19 pandemic, which for the purposes of this study, we mark as March 24th, 2020, when Massachusetts' governor declared a statewide stay-at-home advisory. In our analyses, we focus on nearly 3,000 children represented in the parent survey data. The sample was sociodemographically diverse, and children in the sample were between 3 and 4 years old when the study started in September of 2017, meaning they were between 6 and 8 years old when the pandemic began in March 2020. In general, these demographics broadly represent the population of the state. In terms of outcomes, we considered parent-reported measures of both family well-being and child behaviors. We collected information in each wave about parents' well-being using measures of parental mental health and parental stress, about family dynamics using measures of household chaos and parent-child relationship conflict, and in terms of child behaviors, we captured children's externalizing, internalizing, and adaptive behaviors using the BEST, and children's dysregulated behaviors using the BRIEF. Our primary analytic approach involved regression analyses with child fixed effects to understand whether there were changes in child and family well-being associated with the start of the pandemic. This method estimates within child changes and outcomes between the pre and post-shutdown periods. So rather than compare levels or changes across different groups of parents or children, we compared individual respondents in the post-shutdown period to themselves in pre-pandemic times. Using this approach, we found statistically significant negative changes in all 8 outcomes associated with the start of COVID-19 shutdowns. So to summarize, we saw declines in children's behaviors, particularly those related to children's self-regulation skills, like their externalizing and dysregulated behaviors. And we also saw declines in parental well-being and in household dynamics. Together, this evidence lays bare the pandemic's interruption to parent and child well-being. These findings offer additional motivation to continue to mitigate the coronavirus disease, because first and foremost, reducing the threat of the disease will allow children and families to begin to more widely access the critical supports they need to thrive. These findings also indicate the need for strategies that promote families' economic security and parental well-being, as well as those that directly support children's well-being. In particular, children's declines in behavioral health had magnitudes on par with those that universal prevention and social and emotional learning programs can address. I encourage you to read our paper in the Journal of Developmental and Behavioral Pediatrics for further details on our findings and their implications for clinicians. I also note that this work took place in spring 2020 when the pandemic was just beginning, but we are continuing to work with this sample. Additional findings from our study will be posted on the Early Learning Study at Harvard's website, which you can find here. Thank you very much for your time and attention to this important topic.